role you've played has been critical. Really appreciated your efforts in this regard. I do want to just let you know what the format for today will be. I'm going to run through essentially the main features of the shift to phase 2, and I've got a couple of colleagues here with me today. Dr. Joe Bourne, who leads the Care in the Community program here in the Ministry of Health, and I've also got Viv Rickard, who's the Deputy Chief Executive for Service Delivery at the Ministry for Social Development. Also over here on my left is Michael Dreyer, who is our data and digital whiz. He's responsible for the team that has done an enormous amount of development of some of the digital tools over the last 2 years supporting the COVID response and also the vaccination program. So he'll talk through a little bit later on some of the new digital tools that are coming online to support the move to phase 2. So phase 2 and phase 3, should we get there, are all about flattening the curve. We want to reduce the number of cases and the spread of cases to the greatest extent possible. The aim is, of course, to keep people well out of the health system, out of our hospitals, and to make sure that the country keeps functioning to the greatest extent possible. The key features of phase 2 you will be aware of. They've been announced over the last few days. But foremost among those are the reduction in the isolation period down to 10 days for cases and contacts down to 7 days. The use of rapid antigen tests, which I know there is a lot of interest in, and in particular to support the critical worker exemption scheme to allow people to be back at work if they're identified as a contact, if them being at work is critical to a service continuing to run, with the use of daily rapid antigen tests. And as I've said, the greater use of digital tools, and we'll go into how those are coming on stream and what they will deliver during the discussion today. So just starting with cases and contact tracing, the digital technology has and will continue to help us identify new cases and contacts more quickly. Most cases will now be notified by text message that they've returned a positive result, and that message will provide a link to information around self-isolation, how to inform others that you've got COVID-19 and whether they're a contact or not, how to look after yourself and what help is available. Cases will be invited to fill out a web-based form to help ensure that they receive any health or other supports that they might need to help them isolate safely and successfully. It might be, for example, if a person is immunocompromised or has an underlying illness that would be severely impacted either themselves or a member of their household, and then they will be able to have a discussion with our teams who will determine what sort of support they might need. As part of filling out that registration online, they will identify who their close contacts might be for contact tracing purposes. Of course, we would imagine that most people will be immediately identifying their close contact members, particularly family and household members, but others perhaps that they work with. And that will enable us to get a nice speedy response and really get both cases and contacts isolating straight away. So most people, and we know with Omicron, who will have a mild to moderate illness, they won't require any support. And so they won't require any phone interviews, but there will still be that option for people who do either prefer that or who don't have ready access to digital tools through a cell phone or a computer. And our public health unit teams will be focusing on those cases and outbreaks and settings that are at high risk, like aged residential care, obviously corrections facilities and those sorts of places, or where it might be a super spreader event, and there's a lot of people to follow up. Just to emphasise again, just as it is now, there will be phone opportunities for people, remembering that most of our cases now are notified that they are a case by phone. The majority of people now won't be receiving that outbound call, but it will be there for those who need to. I've talked about the isolation periods for cases and contacts, and specifically for household contacts. They will now only need to isolate for 10 days. And the 10 days starts the same time as the case in their household returns a positive test. They will be asked to get a test on days 3 and 8, and if that's negative on both occasions, then they get released at day 10 along with the initial case in their household. We do know that households, just with Delta, with Omicron, are the place where we see the highest conversion rate. So anywhere between, at the moment, between 30 and 50% of household contacts with Omicron are becoming cases themselves. So we will still expect to see that. Likewise, as with cases, our contacts will be notified by text message and they will receive links to information they need. Now, I should say that we will also continue to use QR codes, Bluetooth, and other locations of interest as well will be put up to identify places where we do need people to isolate if they are high-risk settings. We've just done some analysis of our Bluetooth notifications over the month from sort of early January to early February, and interestingly, and here's some numbers for you, of 2,258 community cases who were interviewed, around 20% of those, 462, were provided with a Bluetooth token that then allows them to anonymously generate a notification out to others who may have been in close contact because they swapped a Bluetooth signal with their phone. So about 20% of people who were contacts in that time received a Bluetooth token, and of those, around 90% successfully used that token to send that message out anonymously. Again, it doesn't identify either the sender or the recipient. And we know over 1,500 devices received a Bluetooth notification during that month. And about a third of those resulted in people calling Healthline. So 538 calls to Healthline in that month were people who identified as having been notified via Bluetooth. And overall, though, it was less than 1% of our contacts who were identified through Bluetooth notifications. So saying it's still an important technology. It will become increasingly important as we go into phase 2, and we will keep using it until it reaches a point where potentially it's resulting in what's been called overseas a pingdemic. We don't want people to be notified all the time when they may in fact not be a contact. There's also been quite a lot of discussion around what a close contact is, and essentially we have a very clear definition of this. I'm not going to read through it all, but it is very clear on our website. Those who live in the same household are clearly the most important, and others with whom you've spent quite a bit of time. And the general sort of rule of thumb is if you've been close, that is within 1.5 metres of someone who is positive for more than 15 minutes and they were not wearing a mask. That's a close contact. And of course, direct contact through kissing or sharing a cigarette, not much of that happens nowadays, which is good. Maybe a vape or a drink bottle, you would be a close contact. Or if you know someone who is a case has coughed or sneezed directly on you. And spending time in a confined indoor space, especially where there were activities like singing, shouting, exercising or dancing going on, these are all things that create a higher risk and mean that someone will be a close contact. So that definition is very clear on our website. So just with regards to testing, PCR testing remains the mainstay of how we will identify and, of course, diagnose our COVID-19 cases, particularly early in phase 2. We will move during phase 2 to using rapid antigen tests in some cases for diagnosis. But it has to be a point when we know there is a decent prevalence of cases out in the community. Now, we've got some data already from yesterday from Middlemore Hospital, where you would imagine people turning up at hospital would be more likely, because they're turning up with symptoms, more likely to have COVID-19. So yesterday at Middlemore, about just under 10% of people presenting to the emergency department, and everyone received a rapid antigen test, about 10% of them returned a positive rapid antigen test. And the reason that it's useful to use rapid antigen tests there is because there is what's called a high pretest probability. These are unwell people, they're turning up seeking care. But out in the community where you've just got asymptomatic people, even in Auckland at the moment, which has got about 3/4 of our cases, rapid antigen tests are just not sensitive enough. Our press gallery had an example of this earlier in the week where someone returned a positive rapid antigen test, but it turned out it was a false positive, and that will still be the case. But as case numbers increase, rapid antigen tests will start to play a role in helping us diagnose and identify cases. Of course, from today, rapid antigen tests are playing a role to support our critical worker exemption scheme. And I have checked online. You can look on HealthPoint and find out where the closest place is that you can collect rapid antigen tests if you are part of that scheme and you've been notified as being a potential contact, and you are required to go to work as part of that critical worker scheme to continue to ensure that that business can continue. We will also be using rapid antigen tests once we open up to Australia from the 27th of February. People coming across the border who are going home to self-isolate will be provided a pack of rapid antigen tests. And likewise, some of our COVID response workers who are currently undergoing surveillance testing using PCR will transition to rapid antigen tests, so we free up that PCR capacity for our diagnosis and testing in the community. What I should say is there's been a big increase in testing, people seeking testing, particularly in Auckland over the last couple of days. And I just want to emphasise that point. The people who we need to be tested are people with symptoms or those who are known and notified as being close contacts. It's not helpful and not necessary for people who don't have symptoms or who are not close contacts to go and seek testing, perhaps just because they would like to be reassured. And it's important we make sure our testing is used for the right things at the moment. I'm going to hand over now to Dr. Bourne, who's going to come up and just walk you through the care in the community process, what that looks like for someone who's able to look after themselves and what that looks like for someone who will require a degree of support from either the health system or our social support services. And then after Joe, I'm going to actually invite Viv to come up and just make a couple of comments about how our social support services link with the health ones. And then I think our tech team here is going to walk you through some of the new tools as well. So Joe, over to you.
Kia ora koutou, ko Joe Bourne, taku ingoa. So I'm just here to talk through a bit of the detail that Ashley has touched upon when it comes to how we're going to support people to self-manage during the time that they've got an infection with COVID-19. This is a pretty big shift, both psychologically for both our population and for the healthcare sector, because to date we've really been providing fairly intensive support, even for people who have been relatively well in the community, in terms of the number of phone calls that they receive from nurses, from doctors and from nurse practitioners. Now, as we move to a situation where we're expecting larger numbers of cases and with a variant that actually causes less severe disease, we have an opportunity for us to use greater self-management as people would be used to doing when they get respiratory infections at other times. So the whole principle of this is that people can continue to receive good quality and appropriate care, clinical care, whilst preserving the resources in the health system and in those other welfare supports to be available for those that have greatest need. So by enabling people to look after themselves, and that's about people looking after not only themselves but their whānau and their communities, we can then preserve healthcare resources and other resources for those with the greatest need. So what I'll do is just walk through the different stages of the pathway that's there for people to self-manage. As Ashley's already touched upon, the beginning of that pathway comes with a positive notification. And we know that that positive test that tells you you're COVID positive is currently through a PCR test, but in time we'll move to other types of testing. And Michael will touch upon those methods that we're going to have in place that people can upload their results in the future. But for now, people receive that text message. And again, we'll show you what that looks like, because we're also aware that when people receive a text message that says, click on this link, please follow this link, there can be some concern that it's a part of a phishing scam or something like that. So we want people to be reassured this is what the text message looks like, and it will be incredibly helpful to us if they can click on that link and take themselves through to a self-service form. Now, we've got systems set up where people will also have a phone number. So anyone that doesn't have the ability to click on a link can be absolutely reassured that we have telephone capacity to actually provide you with the support that you need via a telephone instead. And behind all of that, we have local care coordination hubs who have a responsibility to make sure that nobody slips through the net. So they will be monitoring when each person's test comes through. That is flagged to them at their local hub level. They'll be monitoring that list, and they'll be able to see as and when people have that first contact and that first assessment. For those that aren't seen to have that assessment, they will then follow that up by any means necessary. And we already have those local coordination hubs who are working very closely with, particularly with iwi and other Māori and Pacifica providers that know their communities and can reach out into those communities to contact people where we can't see any evidence that they've been able to interact with us. So just coming through to that self-management pathway, when people click on the link, they'll be taken to a self-assessment form, and that form will collect data that we've previously been collecting over the phone. And that will involve an assessment that considers people's clinical needs, any requirement, any constraints or difficulty there might be around them self-isolating, and also what their Manaaki welfare needs are. That then gets, all of that information gets pushed out to the appropriate providers so that they can then take the actions that are needed in order to provide the care required. And this is a real example of where we're having to work across multiple agencies so we can benefit from all of the skills that they bring in order to be able to support people. We anticipate that most people will be able to self-manage, and we'll identify that through the information that we've gathered. And if somebody's then on the self-management pathway, they can really expect very little contact from the health system or any of the other agencies, but they will have extremely clear advice as to as and when they should escalate their care, because we don't want people sitting at home wondering, what should I do? I feel more unwell. So again, reassuring people that all of that support is available, but it will just be down to people and their whānau to activate it when necessary. So that could be a phone call that you make to your general practice if you're enrolled with a general practitioner, or through a telehealth provider if that's needed. So the care is there. When you're then reassessed, that care provider will say, okay, this is somebody who does need additional support, and they will then be contacted regularly like other cases are that are under active management, or they will make that decision that actually those symptoms are okay, they can provide reassurance, and that person continues to self-manage. Finally, at the end of the self-management, at the end of the isolation period, people will be automatically notified, again via a text message where they are able to receive text messages, that the period of isolation is complete, and then they can return to doing what they normally do. What we will be doing is working with employers to ensure that they understand that the initial text messages that people receive at the beginning of their isolation period and at the end of the isolation period can be used as evidence of the fact that they have been unwell and haven't been able to be at work. Again, looking to see how we can preserve the capacity of the health system, and particular general practice, so they're not spending time having to provide medical certificates to everyone when they go back into work. So that's just a small example of how we use the digital tools to relieve any pressure there may be on the health system. And that's essentially how we're looking to run things. I think that, again, just reinforcing the message, and this is for people, particularly from our priority population, so Māori, Pacifica, people living with disabilities, is this self-management pathway won't work for all of those groups, and that's okay, because this self-management pathway is what we have to create the capacity in the health system in order to be able to provide that higher level of care people from those priority populations may need. And our local care coordination hubs are the are the safety net that ensure we can't design a pathway that's going to be appropriate for every single individual person. So what we do is we empower our communities and our local providers with the ability to design the appropriate bespoke pathway that is going to support people with higher needs through their period of isolation. So we have got Viv, who's stepping up in a second now, and we will have a video that we'll show at the end, which demonstrates an example of the resources that will be available online for people. And then Michael will talk people through some of the specifics of those digital enablers that people will be able to access when diagnosed with COVID-19. Thank you.
Ka tira e tautoko ngā mihi o te tumu whakarai ki a tātou ko tai mai, no reira tēnā koutou. Ladies and gentlemen, I'll just try and make sure we keep the comments short. I want to highlight a few things. Firstly, in late November, ministers made a decision that actually heading into Delta and Omicron, which we didn't know exactly what was going to happen in the future, that we needed to put more support in to help our busy health colleagues. So as a result, they've asked MSD to coordinate a welfare response with 9 other agencies, and that's what we intend to do to help our health colleagues and the messages that Ashley and Joe gave. In doing so, our model mirrors the model in health. So they have an online form, as Joe has talked about, and that self-assessment piece, we've got a bit that's attached to that form which outlines the welfare needs. We've stood up things at a regional level, at a local level to support the health response and the welfare needs. We've funded 150 providers throughout the country. Out of those providers, around 70 of them are whānau water providers, and we've got also 12 Pacifica providers throughout the country, and a lot of them are tied into the same providers that health have. So I think the key for us is to ensure that people are able to isolate and safely with the health support when required, and also with the welfare support. But I want to highlight that really for us, the key things now are really for New Zealanders as a whole to get prepared. Because generally, prepared's not just about buying stuff, prepared's about having a plan, contacting the right people, knowing who you will go to, knowing who your neighbours are, and if you have to isolate, who will bring things to your place. Our welfare response will be for those that can't afford to or are unable to access help while they are isolating. So it's for the period of isolation. And I think initially I'd say that we've been going for a while, and it seems that the biggest immediate need has been food, and as a result, we've funded 205 food organisations throughout the country as well to support the welfare response. The key for us, I believe, is that we keep talking about coming together as one to help. There are some people that are going to need support, and others will be okay. And I think the mechanism, both through health and through the welfare coordination agencies, is to pivot our emphasis on those people. And then with that, we'll be able to do really well. So ladies and gentlemen, I'll wait for later to see if there's any questions, but I think Ashley and Joe will just hold it there for today, and we'll see what comes about. Tēnā koutou.
Kia ora everyone. I'm Michael Dreyer from the Ministry's Data and Digital team. With me I've got Merrin McLeod, who's one of our hard-working project managers. What we're going to do is just do a bit of a quick demo, show and tell of some of the tech. And as we go through, we'll talk you through some of that, and afterwards we'll take some questions around it. So I'll hand to Merrin.
Sure thing. Thanks, Michael. So as everyone said, starting from today, we'll start texting positive case notifications. Those will come from the text message number 2328, which is also the same number that the vaccine messages are sent from, and that will contain 2 links and a number of phone numbers. The first link will be to the contact tracing form that's been described, that also has some elements of wellness and welfare requirements. So this will be, this is a form through which you can share your information, share the information from your COVID Tracer app, including your diary and Bluetooth tracing, any other high-risk exposures, and information for your close contacts so that they can be notified, as well as linking through to the welfare support systems that MSD set up. Initially, this is going to link through, so today this is going to link through to the Ministry of Health website for further information about what people need to do as a case or as a contact. And starting from tomorrow, this will come through to the COVID-19 Health Hub, which has been designed to make information relevant and easy to understand so that people in the stressful situation of testing positive for COVID can easily understand what they need to do and what help they can access. I'm also going to give a quick demonstration of the feature that's just been added to my COVID record, which allows people to self-report the results of a rapid antigen test, a RAT result. So this has been deployed this morning, so this is this is available now.
I've seen cases coming through here this morning.
Yep. And so this will help people to understand not just to report through the result of their rapid antigen test, but also to understand what how to interpret it. So if both the control and test line are visible, then that indicates that that it's been detected. We're being careful about the wording here because at the moment there is a so it's detected, and the advice is still to get a follow-up PCR test.
That may change over time, obviously, as we move through higher numbers of cases.
And that's using my COVID record, which millions of New Zealanders have signed up for to access vaccine passes.
What we saw with during the vaccine program with things like My COVID Record and Book My Vaccine was between 80 and 90% of New Zealanders were up to, I guess, work with us digitally through those channels. We were able to provide support to people that had tech but didn't quite find a way to use them well, so we could support them to use them well, and obviously for the other 10 or 20% we could push them through assisted channels or provide direct support on the ground or locally for them. So it worked really well, and this is what we're going after again here.
I think that's all.
So we'll open up for any questions.
Oh yes, the video. Yes. Okay.
If you have COVID and you've been asked to isolate at home, here's some information about your symptoms and when and who to phone. You'll be given the number for a healthcare team in case you need them. While you're isolating, you'll need to keep an eye on your symptoms. You might be asked to take some recordings, like your heart rate and oxygen levels.
What does that mean?
It means you measure them and write them down, even if you're feeling okay. These are the things you'll need to check and write down. Taking your temperature if you have a thermometer. Not everyone gets a fever, but it's worth knowing how to do it. You may need to measure your blood oxygen levels and heart rate using a pulse oximeter. You should record how you're feeling at different times of the day. Better or worse? How your breathing is going and any new symptoms you have. Knowing when and who to call for help is really important. Call 111 if you have a sudden change in breathing or bad chest pain, you're confused or not thinking clearly, you're feeling faint or pass out. Call the healthcare team if you have new or worse trouble breathing, your symptoms are getting worse, you start feeling better but then get worse, you have a very dry mouth, aren't peeing much, or are feeling lightheaded. Remember, if in doubt, give them a shout. You can do this, and if at any time you have any concerns, that healthcare team is just a phone call away.
Can I just ask a question around the technology? Is that okay?
Yeah, look, let's maybe Michael's pop there. So, yeah, thanks very much for the demo there, and some interesting new symptoms on demonstration there in the video. And so, yeah, we'll need to do a little bit of juggling at the top here. But Michael, if there's a question on technology for Michael, come up to the podium so that you can.
So with all the data, with all this technology, do you require data? And what about our whānau in the rural areas that don't have access to data?
Right, so the way we've designed the services, as Joe touched on, this allows for those 80 or 90% of New Zealanders that can self-serve digitally. For those services that are provided online, wherever possible, we provide basically funded data channels so that it doesn't rely on you having data on your plan for a number of our websites and services. It doesn't always work like that, but wherever we can, we're working with the big telcos to make that what we call sponsored data. And then obviously if the tech's just not going to work, or you don't have access to
Like Waikato Moana and Te Aroha
in remote areas, and that's where the local care hubs, the GPs and the local providers step in and can provide more direct services on the ground. And we saw that during the vaccine program as well. Yep.
It seems like in phase 2, locations of interest become slightly less important, particularly with the tighter definition of close contacts and the self-reporting. Is that fair? And can you just explain, will they still be regularly updated, regularly published? How will that work?
Yes. So locations of interest will still be a thing, but there are two new aspects to this. First of all, there will be so many of them that not all will be able to be followed up by our contact tracers. That's the first thing. The second is, and so we want our contact tracers to be focused on those exposure events that are the highest risk. And that brings me to the second point here. We know already from what's happened over the last month which our higher risk exposure settings are. And they're not, for example, public transport or supermarkets and those sorts of places. So we don't need to necessarily identify people in those places as contacts. This will rely on everybody doing what we've required really right through the last 2 years. Even if you're not notified as a contact, if you have symptoms, go and get a test. And so that's not changed. But we will be focusing our exposure events and any notifications about locations of interest on places that are the highest risk.
People might be thinking, what's the point in scanning in now?
Yeah. So very important to keep scanning in, because we want people will want to know and need to know if they have been at one of those higher risk locations of interest, exposure locations, first of all. And secondly, also, as I've said, Bluetooth is still playing an important and useful role, and so we do want people to keep their Bluetooth turned on still as well.
People may be worried though about being caught up and as a close contact having to self-isolate. For that reason, they may choose not to scan in or turn the Bluetooth off. What would you say to those people? Yeah,
what I would say to those people is one of the advantages of going to phase 2 is that it will be a much narrower group of people who will be identified as close contacts. So if you continue to scan in, and that is important, and you are identified, that is because you are at higher risk. So actually, it's even more important and more useful to scan in at phase 2, because if you do get a notification through your app, then you're actually in one of those higher risk settings, and it's even more important to isolate there.
Will schools be a part of that sort of high risk sort of locations to notify efforts, or will it sort of be up to families to notify the school that their child is tested positive?
So on your second point, yes, very important that families do notify schools or other, and likewise that people notify their employer if they test positive, because that allows the schools who've got very good guidance around this with support from Ministry of Education to actually assess what the risk is there. And those are the sorts of settings where our public health units can also provide advice. But I dare say we've already had quite a number of schools where they have had cases, particularly in Auckland, and they are responding really well. They've got very good, clear guidance and support from the Ministry of Education. But it is important for parents or guardians to notify schools if a child does return a positive test.
How do you see POS? How many people will be getting POS oximeters, and how many do we have in the country?
Yeah, so we have many thousands in the country, and we've got another 50,000 on order. However, what I would say is that most people will not need a pulse oximeter. And so to date, especially in Auckland, the vast majority of people have received a pulse oximeter. That will not be the case now, again, partly because Omicron is a much less severe illness than a Delta illness. And so most people, those who are on the self-management pathway, won't need a pulse oximeter, and they will be provided to those who do need them, who, because of, for example, pre-existing conditions, are more likely to deteriorate and will need to regularly monitor their oxygen saturation, and they can be very useful in that setting.
With rapid
Okay.
antigen tests available from today for that specific group, what are you hearing from on the ground? Are things running smoothly?
Well, what I would say is I haven't heard to the contrary, and I would have if they weren't running smoothly. Early days yet, but look, we've been working with businesses already and some places already over the last week or two, even under phase one, where there were specific needs. For example, Air New Zealand had a number of crew who would have had to have stood down, and we were working with them on getting supplies for rapid antigen tests. And one of the other things we've been doing is working with directly with, and will continue to, businesses that might have a large number of workers who are potentially contacts. And there's an example of that at the moment down in the Nelson-Marlborough region with King Salmon, who have got a number of cases in one of their processing plants. There are 250 potential close contacts amongst their workers. They've already had rapid antigen tests, and then they're going to be using the rapid antigen test to allow the facility to keep operating.
Today being the first day of phase 2, how would you describe where this current outbreak is at? Have we reached the peak, or is that still yet to come?
We're definitely still on the way up, and we've seen over these last few days, the high hundreds of cases. You can expect the case number today to be over 1,000. Actually, right on the first day of phase 2, when we said 1,000 was about the time we would be moving to phase 2. If we look at the experience from other countries, there is no doubt that case numbers will keep going up. We now have them in all cases in all regions of New Zealand. So all the more important people keep doing the basics well. That's really important. Get tested if you're positive, and of course, I have to take the opportunity to say it. If you haven't yet had your booster, please do go and do that. It's very important and helpful. So just at the back there. Yeah. I'll just. I'll come.
On the RAT testing, will that self-identification, is that going to be included in our daily case numbers, or if not, when do you expect it to be?
Yes, so that's a really good point. We are going to start including the results of positive rapid antigen tests when we reach the point where they are being used for diagnostic purposes. At the moment, they're still effectively being used as a sort of a screen. If someone returns a positive or what was the right terminology there? A detected result, then they still have to have a PCR test. So at the moment, our case numbers will be those cases that are confirmed through a PCR test, whether that's the first test or it's a follow-up to a rapid antigen test.
Will that be in phase 3?
It may still be in phase 2, and it will depend very much on whether our PCR capacity is able to keep up. Then we will signal that shift. Likewise, as we move to higher case numbers, we also know that we won't be. Our case numbers won't be an indicator of all the cases that are out there. Even now, we know there are some cases that are not some people who are not necessarily being tested, so we're not capturing everyone. So we're going to provide both the confirmed cases through PCR testing. We will include rapid antigen test results when we get to that point. but we will also include an estimate of what we think the wider case numbers might be based on some modelling and including the results of our wastewater testing, because ESR is now able to give an indication not just of a sort of a yes or no, but actually of an estimate of the number of cases from a region where the wastewater collection might be happening. I'll go.
What would it take for you to recommend that we move to phase 3? What would the settings be?
Similar to those that have been laid out already, but it's very much around our capacity and our testing system, what's happening with our hospital and primary care capacity, and the caseload is clearly important. Indicatively, it would be around 5,000 cases a day, but it's not inevitable that we do move to a phase 3 at this point in time. I'll stay over this side and then I'll come back over here. That's
Sorry,
right.
just on that first point before,
Yes.
so will schools be one of those high-risk locations that the Ministry of Health will be notifying, or not?
No, not necessarily, because in the first instance, parents will be notifying the schools, and they've got a really good protocol, and many dozens of them have already been developing that protocol, following that protocol. If they need support from the local public health unit, that will be there, but in and of themselves, schools are not a high-risk setting.
Thank you. You've talked about people who can look after themselves, people who need care. There's probably a third group, though, isn't there, which is basically the non-compliant. What practical capacity is there for this, under this system, to actually monitor compliance? And has any consideration been given to the use of geolocation technology?
The geolocation technology, in what way, sorry, are you suggesting that?
Well, as we've seen in Taiwan and some other places where
Right.
cell phones have effectively dodgy repertoire.
I see. You mean sort of compliance with the requirement to self-isolate. It's not something we've used and not something we're planning to use. Our response right through has relied across all domains with people doing the right thing, and for in very large part, that's what New Zealanders have done, and that's why we've been successful to date.
So you're just basically relying on the likelihood that most people will be compliant rather than trying to enforce compliance.
Yes, and that's clearly not something that is possible to do with such large numbers of cases, and I've got a high level of confidence that people will be wanting to do the right thing to protect themselves and their whānau and the wider community as well. There's a question down the back.
Yeah, how close is the current PCR testing to capacity, and how soon do you think that will be reached?
Yeah, so our 7-day average number of tests is about, I think, around 23,000 a day. Our total capacity at the moment, we could surge up to 60 or 70,000 tests a day. However, there's a rider on that, and this is particularly important in Auckland, where their current capacity is around 20,000 a day, because once you get a reasonable number of cases and the positivity rate goes up, they're less able to pull tests. And so what that means is with very low rates of infection in the community, you can do even up to 8 samples all at once, and mostly they will all come back negative. And if you get a positive result, you pull them all out and do them all individually. With positivity rates of what they are now in Auckland, so somewhere between 3 and 5%, they're less able to do the pooling. And so that sort of reduces the capacity. But at the moment, our non-pooled capacity nationwide would be about 30,000. However, most places around the country are still able to do some pooling.
And just on the process of Parliament, how concerned are you that could be a super spreader event, and do you think it should have been stopped sooner based on that?
It could be an event where there are infected people, and because there's probably a lower vaccination rate there than there might be in the general population, and because people are quite clearly in close contact and not wearing masks, that does increase the risk. So again, I think the rules are there for everybody, and they are there to protect not just individuals but to protect others. And I think this is a really important thing about Omicron. It may not be as severe an illness for most people if you're young and healthy, but it sure is and can be deadly for people who have got pre-existing conditions, who are immunocompromised or who are older. And those are the people that our measures, like use of masks and physical distancing, are designed to protect. And so, same as ever, do it for others if you're not prepared to do it for yourself.
Thank you.
Question over here.
Māori question. So how do you know this strategy will work for Māori, given that the Māori providers are overstretched and low skilled workers, very few skilled workers? You see Waikato Moana, just one example of a clinic that had to close, and that's been around the Motu. So how do you know it's going to work for us?
So I'll just make a quick comment, and then Joe might want to comment as well. Interesting, I was looking this morning, and Dr. Rawiri Jansen was suggesting we should have gone to phase 2 last week. And one of the reasons that we have designed this phased approach is because it allows us to absolutely focus our resources and the response on those communities and those whānau and individuals who have the highest needs. And so we've been working...
Come to you rather than the clinics go to our whānau. As an example, Waikato Moana, 2.5 hours to get to Rotorua clinic, or 2 hours back into Tāne Atua. Very difficult for those whānau. So you're asking them to come to you.
Not necessarily. And Joe, you might want to comment on the sort of the range of options that are available.
Kia ora, and thank you for the question. My own general practice where I work is based in Te Puke, and that's with an organisation called Potiri Trust. And I guess I can speak from some personal experience about how we're engaging, not in a really remote location, but in one where we do see significant high need amongst our Māori population. And I don't think as a health system we should ever take for granted any of the effort that's put in by our Māori providers. But what I have seen repeatedly during the last 2 years is that whole community stepping up and supporting each other. And that's what we've been doing on a daily basis when we have new cases coming in. So where people don't have the ability to come to us, we still do go to them. Now, another example away from where I work is having conversations with the teams in Tairāwhiti, and they're saying that their approach there is really tailored on the meeting of not just engaging with iwi, but engaging with hapu around the coast, where those hapu know who their most vulnerable people are in those areas that have the least access to Wi-Fi, etc. And they're going to use those people and those whānau and hapu connections to be able to reach into those communities and ensure where travel isn't possible, they can still get access to the care they need. So, and the example was given around pulse oximetry and that idea of you can measure your oxygen level. So what we've done there is we actually have a person that, whilst maintaining appropriate social distancing, they actually go out and they demonstrate the use of the tool, which is quite unfamiliar for people, and then they can go back and they can support the recording of those readings and interpretation, and when necessary, come back to the clinicians who are part of that team and help understand whether that person is at particular risk. And ultimately, if what we need to do to preserve that person's healthcare, we can arrange for transport to take them through the hospital level care. We think that that's going to be a very small number of people, but those safety nets are still there. So I wouldn't underplay the challenge, and I recognise this challenge actually exists outside of COVID as well, but we do have lots of mobile teams who are doing their best to reach into those services. And I think this is where the Ministry of Health's role is to support local communities to deliver the care they know is needed within their areas.
Thank you. Can I ask just a couple of things. The first one is the Prime Minister, and it is about care and community, but our Prime Minister and Chris Hipkins, they both acknowledged that there were some of our whānau who are isolating in cars. So, however, they passed it on to the Minister of Housing to get them to get care. So are we saying then that our whānau who are having to isolate in cars, sheds and garages will not get the care and protection that they care in the community that they require because they're not on houses? That's not what they're saying, are they?
No.
Can you clarify that?
Yeah, tēnei te whakahokia ki tō pātai. So the people should not be isolated in cars during COVID. We know we've got a housing and accommodation challenge in our country pre-COVID, and that exists today, and in some ways it's been exacerbated by what's occurred. Equally, we know that under pressure, there are some times within some regions around the country, not all region has significant issues, that we have to use alternate accommodation options to actually help the whānau. Generally today that should really be driven by the clinical piece, that they have to isolate because of the clinical, not the welfare piece. It might be because of the way the whare is set up. But can I just reiterate, I don't want to see people, and they should not be isolating in cars. There's no need for it. We can find places for them to isolate.
So what role, if any, does MSD play with providing emergency accommodation like motels so people can safely isolate?
Yeah, well, that's our normal job. We have to provide emergency accommodation today for 5,000 households that are in emergency accommodation. So that's what we do today. We'll continue to do that during COVID and find other options for people. But the sense is mainly that if you have to isolate as a result of Omicron, generally you'll be isolating in situ where you are at the moment, unless there is a need to move you. That's difficult for large households sometimes, and I understand the issues in relation to that, but generally we'll be asking you to isolate where you are.
There is an issue around trust though.
Aye.
And he Māori, pirangi rā, te pirangi koutou katoa, he whakarongo ki ngā kanohi Māori. So we're not hearing those messages from us, and we're having to go through the minefield of all this technology and technical stuff. We aren't having those messages said to us. So again, we're sceptical about whether or not the strategy will be successful for us.
Yeah, whakarongo e tāuatanga o ngā Māori, ngā iwi Māori. So I listened to you. I think you're right. I understand the challenges and issues around remote and our people. But I think, it was lovely to hear about Waikato Moana and the coast, because my Ngāti Whare Tūhoi and Ngāti Porou relations will be ecstatic that you've mentioned them. But I think the issue is actually this is not around just ethnicity, Māori, it's about New Zealand. We do recognise, though, both within the health and the welfare system, we have to do better for Māori, and to ensure that what's occurred before, that we don't exacerbate issues that have gone on previously. And I think that's, you heard me talk about the way we've funded in our model. Actually, if you think about the amount of whānau order providers, they're the largest number. And can I take the opportunity to acknowledge those providers out there? They're at the sharp end and have been for 18 months of the response, and they've been helping out in the community, both for the health and the welfare response, and they're fantastic. So I just want to shout out to them. Kia koe hoki.
Dr. Bloomfield, we have 125 care vans to help vulnerable people isolate. Is this the best solution you've got to deal with issues of household overcrowding?
It's one part of the solution. So we have found the camper vans have been really helpful in some instances, partly because they're mobile, and that so you can take them out to different places, including remote places. But they're just a part of the solution. As Viv said, there are, and in fact, all our DHBs already have had local accommodation arrangements. Those are still there. We also still have rooms available, if we need to, in our large centres in managed isolation facilities to support people to isolate safely if they need to there. And every day there are some people who are going into those facilities still.
Yeah, could you explain what the threshold is for being able to access an MIQ room or get a camper van?
Well, the threshold is based on the people who are doing the assessment, who are talking to these individuals in whānau to find out what their needs are, and then discussing with them what the options are, and it's a joint decision about what's the best thing for that particular person. There's a question here.
You mentioned the arrivals at minimal ED 10% testing positive. Do you have actual numbers on that?
I don't know the actual number. Look, off the top of my head, it was around 250 presentations in that day, so around 25 testing positive. So many of those people would have been seeking healthcare because they were symptomatic, and so routinely there, because if you look at our case numbers over the last couple of weeks, but South Auckland, Manukau, has again been where the highest number of infections are. And so that's just pointing out that's a situation where routinely screening people with rapid antigen test is useful to help, of course, identify if there are cases that may not be symptomatic, but also to protect the staff and others.
Is that happening across all hospitals at the moment?
Not at the moment, but the point here is it makes sense where you've got a a higher pretest probability that someone might be infected, and it's a good example of where it is useful. So any final questions, and then we'll wrap up.
Do you have a sort of idea of when New Zealanders can expect to move to phase 3? I know it's very dependent. Is it weeks? Is it a week?
No, I don't have any idea. But rest assured, we'll keep we will keep updating people on a daily basis, and if we think, and people will be looking at the cases, the numbers, and also we will be keeping people updated on what's happening with our testing and so on. So if there is a move decided to phase 3, that will be signalled well ahead.
Specific providers say large accommodation options outside MOQ or campings and needed, and authorities have been too slow to act on that. Have you got a response to that?
Well, I guess my response would be I don't think we've ever been better placed to have a range of accommodation options, including for whānau that have, where there are large households. And of course, these options were developed in our response to the Delta outbreak, and very successfully, and were a key part of, along with the hard work put in by the Pacific community, a key part of our ability to actually almost get rid of that Delta outbreak. So I think we have got a range of options available in all regions. The regional coordination hubs and the local coordination hubs will be making sure that the proper assessments are done, and if people need accommodation to support them to isolate safely and support their needs, then that will be available.
Just one last one about the Middlemore hospital stuff. Were you alarmed that 10% of the people that presented at Middlemore ED tested positive? Were you alarmed by that statistic?
Not alarmed, but I was pleased to know that they were doing the testing, because right through the whole response to the pandemic is we don't know about cases unless we test people for them, and once we know, then we can respond and do the right thing to protect those people and their whānau. So it's an important part of our response. Thank you very much for your attendance today. Really appreciate it, and for your ongoing work. Kia ora.